welcome everyone to this special webinar on why the forthcoming 73rd UN General Assembly, or UNGA, must not ignore tobacco control. Heads of states of over 190 countries attending this assembly in September 2018 will debate on the theme of sustainable societies. Equally noteworthy are two UN high-level meetings happening on the 26th and 27th of September to end TB and beat NCDs respectively. Tobacco, as we know, is a risk factor for not just TB, but also for non-communicable diseases. Tobacco also impacts environmental health and results in huge economic losses for individuals as well as governments. Of the parties to the WHO Framework Convention on Tobacco Control will happen in Geneva in early October, followed by the 49th Union World Conference on Lung Health in The Hague, Netherlands, later that month. All these are very important opportunities to learn why tobacco control is vital for progressing on the Sustainable Development Goals, the SDGs, which our governments have promised to achieve by 2030. Today's interactive session with key experts on tobacco control aims to prepare us to optimally leverage the above-mentioned opportunities so that end game of tobacco becomes a reality and progress towards the SDGs gets accelerated. A few quick housekeeping announcements. I request the panelists to please take not more than 4 to 5 minutes in response to a question from the moderator, that would be me, so that we have enough time left for the question and answer session. I also request the participants to keep sending their questions and comments even as panelists present and not wait till the end. You can click on the Q&A box, which you must be seeing on your screen, and then type in your question. If you wish to speak, please raise your virtual hand, which you see on the screen, once the open session begins. Without much ado, I would like to introduce today's panelists. Our panelists for today's interactive session are Professor Ramakant, WHO Director General's Awardee for Tobacco Control in 2005. Our second panelist today is Dr. Tara Singh Baum, Deputy Regional Director, Asia Pacific Region from International Union Against Tuberculosis and Lung Disease, or the Union as we more commonly call it. And he's also a member of the WHO Civil Society Working Group on the 3rd UN High-Level Meeting on NCDs 2018. Our third panelist is Dr. Nurul Luntungan, Secretary General. And we also have with us Michelle Legendre, Associate Campaign Director at Corporate Accountability. Before our panelists begin the discussion, I want the participants to answer a question which they can see on their screen. How many people die due to tobacco every year? You have 5 options and you have to check only one. You get only 15 seconds to do so, and your time starts now. Okay, 88% answered that there are more than 7 million deaths every year. 13% said there are 5 million deaths every year. And another 13% said 1 million deaths every year. Well, just to refresh our knowledge, it's more than 7 million deaths every year, which is the right answer. And do not forget that amongst these, 10% are those which are a result of passive smoking. The person not smoking himself or herself, but still succumbing to tobacco.
Tobacco is a big threat to the sustainable development of the world itself, and Southeastern Asia especially, and is one of the most important preventable cause of death. Just to give an idea, 70% of the global deaths are occurring because of NCDs, In India, 61.7% have been observed, and 86% of the premature death due to NCD are occurring in poor and middle class income countries. Now, just imagine, nearly 7 million deaths are occurring because of tobacco. And both these things, if you try to consider, they are very close to each other and linked strongly. More and more links are being found. And it has been found that NCD is also becoming a major cause of poverty and barrier to economic development. So therefore, I would like to, first of all, let you know a very important data, which I'm sure this will clarify, that nearly 50% of the users of tobacco, in whatever form, are going to die of tobacco hazards. And therefore, what is happening is the link to the NCD is very strong. They cause cancers. I will just try to summarize first, and coronary artery disease, chronic respiratory disorders, then diabetes, hypertension, peripheral vascular disease, and then even skin is not spared. Everything is involved. Diabetes becomes a very major issue along with tobacco. Hypertension and peripheral vascular disease, which is not very commonly known to the people. It affects and leads to disability and a lot of despair. And then talking about eye diseases, right from cataract, glaucoma, and the macular degeneration becomes faster and more serious in patients with tobacco consumption. Infertility, and then it breeds poverty, and then kidney disorder. You talk of diabetes, you find 4 times more commoner complications. The insulin resistance develops because the vascularity becomes poor there. And what happens is hypertension, because the vessels start getting contracted, they become narrower. And therefore, this happens all over. Coronary artery, you talk of limb vessels, you talk of retinal vessels. And all these are involved, and therefore they become narrow, and they lead to ischemia. And therefore, you find large number of heart attacks are coming. People do not realize because nobody writes that cause of death. They write down only that somebody died, and if you ask the cause was tobacco. In the respiratory disorders, especially I'll mention tuberculosis, which has got a quite high incidence in some countries, and in tobacco users, there's a 4 times more common the incidence of tuberculosis. So therefore, it's also a very important aspect. If the society has to develop, and especially in resource-crunched countries and places, but also in the affluent countries, what is happening is lifestyle is taking a great somersault. People are becoming lazy, they become sedentary, they don't want to work, and they ultimately what is finding is that we have to somehow or the other control all these things, because these problems are causing large number of deaths, and this will lead to ultimately a very difficult problem. I appeal to all authorities, including NCD Alliance, that this should be one of the major consideration where we want to control and make health the most important issue and have a proper development of society. Thanks.
My next question is to Dr. Tara Singh Bam. The World Health Organization rightly says that tobacco is a threat to development. Yet very often, governments argue that banning tobacco would deprive them of the revenue they need for development. Tara, can you please help us understand the economic impact of tobacco use?
Thank you, Shobha, for putting this question, for our understanding and clarification. Just I would like to clarify here, look at now all the governments, at least 180 countries, now realize is a big problem for our health and development. So that's why they have signed the FCTC. They are on the process of implementing this WHO FCTC. So it has built a momentum to fight the against tobacco and the tobacco-related disease, and also now we can see that the FCTC has also provided some very good foundation toward the elimination of the tobacco. So why I'm saying this? Because now in the past, yes, it was like yes, even some governments they didn't believe on the tobacco, the control. Even there are some the physicians, even there are some the people, even they didn't have that level of awareness and knowledge. But now we are on the different stage. We are now in the 21st century. We all are together to combat tobacco. So we are look at the history. For long times, the industries has been doing really their wrongful their job, and also they are behaving as a criminals. I would say proudly they are really they are criminals. They are killers. And the work with that they work with their front groups, like for example, such as the business group. Now they have joined their hands working with the American Chamber of Commerce, and this organization is trying to block and also manipulate the science and block any new policy development in any country, especially in our Asia Pacific region, in tobacco control. So they have joined in a different their front groups. These are like a business group. Even there are some the scientific the organizations. Even they are now creating their own the foundation, like for so-called like the smoke free. The foundation is established by Philip Morris. So because of their all these criminal activities, now they are trying to again place their the killer products in a market to attract the children and our innocent people. Despite this, if you look at this all their wrongful behavior, what is happening now? I would really salute all the participants. There is no any wrong and right answer. All the answers they are right, because now we have realized that tobacco is a killer. It kills one person, it kills million people, it will kill billions people as well. So now we can, as per the WHO estimates, tobacco kills more than 7 million per year. It's a huge figure. It's a really huge figure, and it means in our settings every day there are thousands of people, hundreds and thousands of people dying due to tobacco-related disease. So that's a huge the public health disaster, we can say. And majority, more than 200 million people, they are under poverty. They all use the tobacco. They use their money to buy the tobacco related products, and they use the money, whatever they earn, to treat the disease that they may occur due to their tobacco related tobacco use. So they spend huge amount of money on tobacco. We have some very good statistic in our setting, especially for example, in Indonesia, more than 10% of household income they spend on tobacco. In Thailand, it's also the very similar figures. So at a global level, more than 10% of the people, they spend their money, the monthly income, on tobacco products and the tobacco related disease. So we can say now that we have very good estimates is provided by WHO, about 1.4 trillion the US dollar they spend on healthcare sectors every year due to the tobacco related disease and also the lost productivities. That's a huge economic impact. So now we can say, now how can we change this scenario? As I mentioned earlier, we are now together. We have a FCTC. We have a empower the policy package that can address the tobacco at the country, at the city, at the village level. So now is a time to really implement, enforce, and also monitor closely. And the other part is now it's a time for to be united for all the governments, all the civil society and professional organizations to counter the tobacco, the industry's false arguments, even to go further to stop the tobacco-related organizations and its products. I think if we do all these things, we will certainly the change will be able to prevent these 7 million deaths that occurs every year. I pause here. Thank you, Shobha.
Thank you, Tara, for establishing beyond doubt the economic benefits of tobacco control. Could you please dwell a little more upon the social and environmental impact of tobacco use, especially the impact on children, women, education, household income you had, and on the environment?
Tobacco is the use of tobacco. Tobacco smoking is one of the really big the factors for our overall the societies. So it has a consequence education, in any our culture or in any in any sector that we live with. So for example, I can give you some example. So it's just for example from Malawi, there are at least 78,000, nearly 80,000 children are forced to work in tobacco sector. So they are in tobacco field. Now, what does it mean? Means they do not have an opportunity to go to school and to get a good education. So that's the big the factors, and it's happening not only in Malawi. It is happening in our setting. I'm from Nepal. Also, it's happening in my country as well, and it's happening in Indonesia, in Myanmar, in Cambodia, in Timor-Leste. So many many countries in Asia Pacific. So that's a big consequences. And also as you mentioned earlier, there are 600,000 people die due to the second-hand smoke every year, and it's mainly happening among the children and the women. So the exposure to second-hand smoke during the pregnancy is a really significant the risk factor for the low birth weight and for the growth of the child, and also the mortality and also the morbidity due to the tobacco-related disease would be very high, and especially on the respiratory illness among the children. So the recent studies that we have, the recent published studies regarding the second-hand smoke among the pregnancy has shown that there is a significant. It's not acceptable. For example, in Indonesia, the pregnant women are exposed to second-hand the smoke almost around 80%. It's a huge. In Jordan, it's very close to 70%. In Nepal, it's about 60%. In Bangladesh, it's about again the 60%. So all the pregnant women now, they are really vulnerable. They are on risk because of the second-hand the tobacco smoke exposure. So we need to prevent this. It's a time really to prevent. How can we prevent? We have very simple tool. We don't need any effective science, because the simple tool is let's ban smoking in all public places and workplaces. That would build a culture to even for the smoker to behave properly. So when they smoke, at least they can go outside the building, they can go outside the house, so that if we really make a good enforcement and implementation of ban smoking in all public places, we can really prevent the significant number of the death and the disease due to the second-hand smoke among the children and the women. And there are some environmental factors. Just I would like to give you some example of this. Tobacco manufacturing actually produce over 2 million tons of solid waste. Can you imagine 2 million tons is a huge figure, and this figure clearly shows that the tobacco industry perpetuates a climate change, and it would also create both the indoor and the outdoor the pollution as well. So there are several social the consequences due to the tobacco and tobacco smoke.
Thank you, Tara. Given the devastating effects of tobacco use on our health, economy, environment, control in recent years in the Asia-Pacific region as a whole, and also in Indonesia.
There's been a lot of things going on in Asia-Pacific. I'm more expert of the Indonesian part compared to Tara, actually. But from my understanding, at least from the history of the conference itself, the Asia Pacific Conference on Tobacco or Health, it started because there was a huge expansion from tobacco industry, multinational company tobacco industry from the Western region of the world to Asia Pacific. Indonesia itself, there's a lot of challenges from tobacco industry, but recently there has been some progress if not relatively good progress for Indonesia, which includes the simplification on tax, that we really try to increase the cigarette price in Indonesia. And there's been a smoke-free law in hundreds of municipal level or district level in Indonesia. At least there's about like 309 out of 518 districts in Indonesia who has a smoke-free law now, implemented smoke-free law. And we also have implemented the pictorial health warning in the last 5 years. And now there are more and more districts and cities who try to ban the advertising of tobacco industry in Indonesia, because tobacco industry is very powerful in this country. So it really takes the commitment from the people, the involvement of civil society, and also the government, especially from the subnational level. And I think the trend is pretty similar with the other Asia Pacific countries. I believe most countries now, they already increased the cigarette price. Like in Philippines and even China, they already have their tax reform. And more countries now leaning towards the plain packaging in the Asia Pacific countries.
Thank you, Nurul. Tara, would you like to add something to this regarding the global scenario on implementation of FCTC and the domestic successes on tobacco control laws? You have been a great advocate and you have done a lot of work in this field.
Yes, and now
yes.
Thank you, Shobha. Just quickly highlight at the global level, as I mentioned earlier, 180 countries are now implementing WHO FCTC. That's the big, the solid commitment from the governments and the country levels. And we are making really good progress on implementation of the smoke-free, ban tobacco advertising, promotion and sponsorship, and also implementing the larger graphic health warning, including the plain packaging. And in Asia Pacific countries, some of the countries like Australia and New Zealand have shown a leadership role in the implementation of a comprehensive tobacco control program that includes the implementation of plain packaging, the tax on tobacco-related products, and ban the smoking in public places and workplaces. So, and in addition to these countries, in other, like as Nurul mentioned just now, in other low and middle income countries in the Asia Pacific region, especially like Philippines, is a role model in a tax reform, and it's a good the example for our country and also at the global level. The Myanmar, Cambodia, Nepal, even India, Bangladesh, Pakistan, the Vietnam. It's really doing really good comprehensive tobacco control program. When I mention comprehensive, it means at least these countries are implementing the smoke-free ban advertising, promotion and sponsorship. They are implementing larger graphic health warnings, increasing tax and prices on the tobacco products, and also they're implementing the very hard-hitting the mass media campaigns. So as a result, we can see there is significant decline on tobacco use, especially Shobha, in India, it's a significant the decrease on overall tobacco use. Even in Bangladesh, recently the GATS Global Adult Tobacco Survey just released, the few weeks back, it has also shown a very good the progress in terms of reduction of the tobacco use in Bangladesh. And similarly, in Nepal, because of the larger graphic health warning, the tobacco, the consumption has been also decreased. We can see now the effect of the good tobacco control program at the region and also at the international level. And this has been, it's not the overnight the job, but it took a long time. At least in our region, it's 6-7 years, last 5, 6, 7 years, the significant the achievements in terms of the network, building the networks, in terms of the building the capacity, media mobilization, gaining the political commitment from the national governments, from sub-national government, as just the Nurul mentioned. So we have really built a very good tobacco control network. Our public health network now is ready to really go for the elimination of the tobacco. So I would say that in this whole the dynamics, the Bloomberg the initiative has played a major role, and I can say this is the Bloomberg philanthropy itself is like one of the game changer of the overall tobacco control, the programs.
Okay, thank you. In fact, I would like to share here that recently Indian government has asked tobacco companies to put a quit smoking helpline number on all their tobacco packages, on tobacco product packages. This is to come into effect from 1st of September, and I hope this will be a good move, at least to help people quit, those who want to quit smoking and quit tobacco products. At this juncture, we would like to hear from Nurul, who, as we know, is the Secretary General of 12th APACT, on why is this conference important in terms of preparing the Asia Pacific regional delegates for the UN General Assembly and also for the UN HLMs on TB and NCDs, as well as for the 8th COP to FCTC.
So as you can see now in the conference, there will be a lot of tobacco control leaders coming and attending the conference. They will share the current updates, especially about the importance of tobacco control in achieving sustainable development goals, because we are much aware how Indonesia is facing the great barriers of not yet accessing or ratifying FCTC yet, but the SDGs become an opportunity when it's clearly stated that in the SDGs, its FCTC implementation is part of a very important strategy if countries want to achieve the sustainable development goals. And all countries in Asia Pacific are committed to achieve SDGs in 2030, including Indonesia. So it's going to be very relevant to the preparation for the UN meetings as well, because there will be a lot of topics that's related to the priority topics in the UN meetings, which include the ends TB. There will be a session hosted by the Minister of Health of Indonesia about TB and smoking. And there will be another sessions just to talk about the importance of tobacco control and SDGs. A lot of youth-related discussions, how youth should be part, who will try to advocate, actively advocating and also implementing. And also there will be a lot of presentations that shows the importance of implementation of FCTC Article 5.3, which has been the greatest challenge, I think, in most countries for implementing FCTC as suggested by WHO, including Indonesia. The reason that we haven't ratified FCTC again, that's because there's a lot of tobacco industry interference in the country itself. I think that would wrap up why it's important, and we hope to see like at least now 800 delegates coming, and we have like 600 academic papers just from the Asia Pacific countries region. There will be at least 100 youth delegates coming, and there will be like media and journalists to highlight this session. So I think it's just the right momentum. It's about a week and a half before the UNGA meetings, and our Minister of Health, who will come to the UNGA, will also attending and open the Asia Pacific Conference in Bali.
Thank you, Nurul, and all force to you and the conference. Moving ahead, we want to hear from Dr. Rishi Sethi as to why is the World Heart Day this year more strategic than ever before.
Most of the mortality and most of the death from tobacco and smoking related disorder is happening from cardiovascular disease. By the statistics of India, every week around 13,000 Indian males above the age of 15 are dying from tobacco related diseases. This is because of nearly 20%, nearly 20.4% of all adult Indian males are tobacco consumption, and the total of, in the percentage form, the total number of deaths that can be attributed to tobacco-related diseases, around 13% of all mortality of India can be related to tobacco-related diseases. This is the data from 2016. Cardiovascular diseases, both according to the WHO predictions and according to the Indian data, most of the global mortality will happen from cardiovascular diseases. That includes ischemic heart disease, heart attacks, and stroke. And and tobacco is one of the important modifiable risk factors for this kind of disease. So if we focus the attention of smoking and tobacco-related diseases with specific reference to cardiovascular disease, and we see its overall impact, any change in the smoking and tobacco consumption pattern will have effect on cardiovascular diseases and ultimately will have a much larger effect on global and Southeast Asian mortality per se. How does the tobacco affect cardiovascular system? The tobacco-related diseases affect, the tobacco affects cardiovascular physiology in various ways. It can activate clotting mechanisms, and it can cause to inflammation of blood vessels, which lead to coronary heart disease, leading to heart attacks and angina, myocardial infarctions and angina. It can relate to tobacco consumption can mean an increase in blood pressure, which again implies the peripheral vascular diseases, cardiovascular diseases, renal diseases, stroke, everything rises by the rise of blood pressure. It can cause insulin-resistant blood clot abnormalities, higher catecholamines level, or give rise to an adverse cardiovascular health. And it can also cause disturbance in the structure of the vessels. When it occurs in the larger vessels, it can weaken the muscular wall and can cause aneurysms of aorta. And if we see, this is something that we have been seeing in our own patients. This is on the left-hand panel. This is the right coronary artery. On the left-hand panel is a smooth-looking tubular normal right coronary artery. But on your right-sided panel, there is a right coronary artery which is hugely ectatic and narrowed and dilated at certain portions. When this happens, the normal pulsatile flow of blood inside coronary arteries is impeded because this artery is very ectatic and it has got a weakening of its muscular bed. And this forms of artery, the ectatic coronary arteries, gives rise to acute coronary syndromes and heart attack because there is sluggish blood flow here, and sluggish blood flow leads to more clotting. Typically, this form of ectatic coronary arteries we are seeing in patients who have oral tobacco consumption, and we have a series of 170 patients where we have proved that oral tobacco consumptions without any other cardiovascular risk factors was leading to acute coronary syndrome and these kinds of ectatic coronary arteries. So secondhand smoke is also dangerous. Secondhand smoke is something which we have to focus our attention to. It is very effectively related to sudden infant death syndrome. When a pregnant lady is exposed to secondhand smoke, it is related to asthma, it is related to middle layer disease, coronary artery disease, lung cancer, and so on and so forth. So this is the 2014 journal's report. It mentions very clearly that reduction in smoking prevalence over the last 50 years from about half in US men and 1/3 of US women to nowadays, which is around 20% and 15% in males and females respectively. This is one of the major risk factors contributing to the decline of cardiovascular diseases in United States. So in United States, cardiovascular diseases overall incidence is decreasing gradually from 1950s to the 2010s, and two major contributing factors for that decline is a decrease in consumption of tobacco and a much better control of hypertension. Next, quitting helps. Within 20 minutes, your heart rate and your blood pressure falls down. Within 12 hours, your carbon monoxide level comes to normal. Within 1 to 9 months, your coughness, shortness of breath improves. Within 1 year, your risk of coronary heart disease is about half that of a smoker. And if you quit smoking to 10 to 15 years, then you gradually come back to the level of risk of non-smoker of cardiovascular diseases per se. You, of course, remain a little higher risk for malignancies. I thank you for your kind attention.
Thank you very much. That was a very scary picture, but a true picture of what tobacco can do to our cardiovascular health. All this makes me wonder that despite having evidence of the devastation caused by tobacco, why achieving the end game of tobacco is still a distant reality. Let us listen to Michel Legendre to understand this dilemma.
We've definitely heard about the health costs associated with smoking use and with the role of the tobacco industry in propagating and exacerbating that factor. I really wanted to focus in on a few key points, one being Article 5.3 of the Global Tobacco Treaty. And Article 5.3 is the recognition and the policy point within the Global Tobacco Treaty that affirms that the goals and the objectives of the tobacco industry is irreconcilably in conflict with the goals and the objectives of the Global Tobacco Treaty. And it makes some really important claims as to how governments should regulate and insulate the policymaking space from their relationship with tobacco industry. Keeping them at arm's length, making sure that meetings that are happening are transparent, are accounting for the precedent of the Global Tobacco Treaty above all else, making sure that the policy-making space at the international level doesn't allow for tobacco industry representation or lobbying or influence. When we talk about making sure that people are healthy and living full and fulfilling lives, we don't get there if the tobacco industry is allowed to help write that policy or help have influence over that policy, or to use the millions and millions of dollars and billions of dollars in profits that they accumulate each year to influence officials, to influence governments. So a few of the things that really are of concern to corporate accountability in this moment and really highlight the importance of Article 5.3 are the ways in which the tobacco industry continues to try to assert itself as part of the solution in a world where we are hoping that people stop using tobacco and people use tobacco less and less every year. One of the ways is through UN partnerships. So while the World Health Organization has made stringent demands of its parties, of itself to insulate itself from the tobacco industry, a lot of other UN institutions continue to align themselves with the tobacco industry in different ways. One of the ways is, I think recently UNICEF was in the spotlight because of a recent expose and how their partnership with the tobacco industry undermined the very ways in which they were trying to support things like eliminating child labor and how the tobacco industry tried to use that role in influencing the UNICEF to really undermine the policy making that was happening elsewhere. So they used one official partnership and they helped influence policy in other areas. Another way is most recently in Nigeria. I think some of our allies at ERA Environmental Rights Action, Friends of the Earth Nigeria, released a press release calling on UNESCO to end its partnership, and the University of Nigeria to end their partnership with the Foundation for a Smoke-Free World, because it's an official university and they're using their partnership, and the concern here is that the Foundation for a Smoke-Free World advancing lower risk products is actually not eliminating tobacco use. It's just finding another pathway for tobacco use to take root. And so these partnerships highlight the essential role that Article 5.3 plays in making sure that the policy-making space is insulated from the influence and the role that the tobacco industry plays, which is that they want to continue keeping their business and their bottom line as high as possible. They want to continue having their product at the foreground of use. And these partnerships are nothing but thinly veiled marketing strategies. They're nothing but thinly veiled points of influence in the policy-making space.
Thank you. At this juncture, I would like to invite Ashok Ramsaroop, who is a widely acclaimed award-winning journalist based in Durban, South Africa. He was senior producer at South African Broadcasting Corporation. I would request Ashok to share his views on this. He was supposed to be our guest moderator for today, but due to some technical glitches, he couldn't join earlier. So Ashok, if you are there, we would like you to share some of your thoughts on today's topic.
Thank you very much, Madam Shobha ji, our renowned managing editor of CNS News Service. Well, warm greetings from the port city of Durban, South Africa. Tobacco control efforts as part of the responses to the 2030 Agenda for Sustainable Development. My country, South Africa, became a party to the WHO Framework Convention on Tobacco Control, FCTC, in 2005. Well, the FCTC guides the global fight against the tobacco epidemic to protect health, reduce poverty, and, of course, promote development. While sharing South Africa's experience in tobacco control, I can say that legislation is important for governments to implement effective tobacco control strategies that increase in taxes on tobacco products, reduces tobacco consumption, and that tobacco industry tries level best to delay or water down tobacco control policies. We can all learn from our learned guest who made it very, very clear. Do not smoke.
Thank you very much.
Thank you.
We now begin the open session for any questions and comments from our participants. Participants, as I told you earlier, you can click on the Q&A box and type in your question. Tobacco use is directly linked to causing more, and you have 6 options there. Causing more of what of these? You have to pick one of them, and as before, you have 15 seconds to do it. So your time starts now. And as I said earlier, there's nothing to feel scared or to worry. Nobody would know. It's an anonymous poll. And just to improve our knowledge. Time's up. Let's see what are the poll results. Okay, wow. 86% said all of the above. What were all of the above? Poverty, hunger, preventable diseases and untimely deaths, damage to environment. So 86% of the participants say all of the above. 29% said preventable diseases and untimely deaths. Very, very well, very good going. Now we begin the question and answer session. We have a question from Shagufta Sultan of Bangladesh. Shagufta says tobacco is the single cause for many diseases. What steps have been taken by the UN to stop its growth worldwide? Tara, can you help us with that answer?
Thank you. Yeah, it's a very good question. I would say, it's not only the cause. Tobacco use itself a disease. It's like we call tobacco cyst. So we need to really, come up with a very comprehensive strategy. So it can come not only from the Geneva, from WHO, but from the household level, from the individual level. We have to really make an action at any level. Action means simple, very simple action. Don't if you see anyone smoking, just give the counseling to him or her. Please don't smoke. It's not good. If you see anyone, the smoking inside the building and also the non-smokers are they're exposed to those the passive smoking or secondhand smoke. We have to do some quick intervention at that venue itself. So what I mean is, we need to build. We know all the strategy. We know the intervention. They are very simple intervention, but now is the time is to take a really serious action by each and every one, the member of the community, the member of the society, and also the governments at the national level, sub-national level, even the sub-district level and village level. We all are part of this whole the game. So it means if we work really together, if we make an action wherever we go, whatever we do on tobacco control, so let's just do it. Then we can really eliminate this. So it doesn't require a very scientific theory, knowledge, skills. It just requires a very simple, our own commitment. That commitment needs to be translated into action. Yeah, that's the request.
Okay. Thank you. In fact, we have a similar question from Raja Mohammed from India. And Raja wants to know, how can we promote smoke-free sites outside shops and in public places? And I think this is very relevant in the context of, as Tara had mentioned earlier, about the hazards of second-hand smoke. And also Dr. Rishi Sethi mentioned how it is affecting more so pregnant women and other people. So what can be done? Nurul, can you give some suggestions? And also Tara, promoting smoke-free. We have smoke-free places, say inside hospitals, inside offices. But what about outside?
I believe Raja is from India, right?
Yes.
Yes. So in India, if you look at the recent the Global Adult Tobacco Survey, the results, it's a really significant in the sense like India is making a really good progress of implementation and enforcement of the COPTA, right? The legislation of tobacco control in India. So that means the exposure to second-hand the smoke in public places and workplaces in India has been significantly reduced. That's a good achievement. But still, there is exposure. There is still second-hand the exposure. So my request to Raja is, let's make your local governments, the state governments, the district, the government system make more accountable. They need to implement and enforce India's tobacco control law, especially the smoke-free law, and there are really good best practices in India already. Like in the Chandigarh, even the Delhi, we go in Mumbai or Chennai. These are Tamil Nadu. They are the best examples. Even in Bangalore. So we are within the country. It's a huge country. There are a lot of things that can be shared, and also the replicate in implementation and enforcement. So this very simple things. Let's implement the law. Enforce the law, engage the media, engage the owner of the buildings, because there is already framework that you have, but we need to make a really good public awareness in that particular city or any districts or the state in India.
Thank you. We have a question from Mercy Annapurani, who wants to know how to engage civil society and communities more effectively in tobacco control. And how far is that going to help?
Yes, I think it's very important, especially in countries like Indonesia, who has implemented its democracy in its political system, because it relates to what Tara has explained about promoting smoke-free sites and engaging the public and the facilities owner. One of the experience that I have is implementing a smoke-free village in one of the villages in Indonesia. Because government in a country that have a democracy, they need people's vote. So it's very important to show that it's people's demand to have a tobacco control policy. And I think that's the example that happened in Indonesia when the government see evidence of public support from civil society who demanded the smoke-free areas. So yes, I think civil society can involve so much in tobacco control because it's quite hard for the tobacco industry to interfere in the grassroots level.
Okay. Nurul, one more thing there. Do you think involving more women is really going to help? Because women really bear more of the brunt of tobacco use, even when they are not using it. At least they bear that economic brunt. So
Yes.
do you think we need to involve more women?
Yes, of course. There are also the stakeholders, important stakeholders that has been violated in terms of their rights for smoke-free air, and also in terms of household spending, because most of the smoke users, majorities are males, and it's the women who also must suffer from the huge household expenditure from tobacco use. So yes, they are very important stakeholders to be involved.
Okay, thank you. We have an interesting question from Amiti Verma. She says she has a background in psychology and so is interested in addressing the social and economic, particularly the social factors which drive people to use tobacco in the first place. Knowing very well the harmful effects of tobacco, but still they become addicted and can't seem to stop them. How can we target these social factors? And once people become users, how can addiction be controlled? Now, I'm sure Tara and Nurul both would like to answer that.
You know, yes, we know that tobacco is harmful, and if you and we have the public poll in many countries, and majority, more than 70% of the people, they know the harmful of the tobacco, but they are still smoking. They are still using tobacco. It's because mainly one of the main reasons in our setting is that the marketing, the tactics of the tobacco industry is really very aggressive, and they are really targeting the youth, children, and the low-income the population, because they know how they can place their products. So one of the first thing that we need to do, we really need to ban the tobacco industry marketing strategy, tobacco industry, the advertising, the industry, the sponsorship and promotional activities to denormalize the tobacco from our society. That is the first part. And the second part, in some of in tobacco industry always claim that tobacco use is a part of the culture, but in reality, actually, it's not, because the tobacco cannot be the culture. Tobacco cannot be the religion. Tobacco cannot be the anything, because it's everybody knows this is, but sometimes they claim, oh no, this is part of the culture. So that's why we need to engage our cultural the leaders, especially like for example, we have got really good the success in Indonesia in terms of engaging the religious leaders to normalize the tobacco from the societies. So there is a really big movement in Indonesia. It's like engaging the religious leader on tobacco control. So that would help to denormalize. And the other part is we are in our setting. We know if you go just outside of your house, we can buy the cigarette easily. We can buy the tobacco anywhere, any part, wherever we go. So that we really need to regulate, limit the access and availability of the tobacco products in the markets. So it should be, we should have the government should have a strong legislation and regulation. And of course, all the tobacco, the products should be very expensive. It should not be affordable. So there are many measures that we can apply at the same time engaging the governments, engaging civil society, engaging religious leaders, engaging any member of our community. So that would really help to isolate the tobacco, to even I always say now we are very near to eliminate tobacco from our society. The second part, like the addiction, of course, yes, it's addictive. So the lessons from that we learn from the different the settings is, the first thing is that the health system should be responsive. And we have wonderful the healthcare the settings in Asia Pacific or in many the low income countries. Very wonderful, because the countries managed to eradicate polio. The country is really is managing or controlling tuberculosis, elimination of leprosy. Very good the health reproductive and child health system up to the community level. Why don't we use that system to help the smoker or tobacco user to quit smoking or tobacco use? It's easy. The tobacco, the user, they need the help. They need the brief advice. So it can be easily provided through the health system. So it is not happening in many countries, but that is one of the opportunities that we can engage, integrate the tobacco cessation counseling program within the health system at any levels.